Hi, I'm Becky.
Hi, my name's Jamie.
My name's Erin.
Hi, my name's Deb.
And I am a peer support worker with the Patient Client Family Council.
My story began when I was in adolescence. I dealt with a lot of anxiety and depression. I was diagnosed with an eating disorder and post-traumatic stress.
I was a patient at the Waypoint Centre about 9 years ago, and I was diagnosed with bipolar disorder.
Until about 4 years ago, I didn't really think that recovery was in the cards for me. I was living with an eating disorder, very severe depression, and PTSD.
I led a toxic lifestyle for most of my youth, and it led to diagnosis of drug-induced schizophrenia. I was hospitalized for 4 years at Waypoint and received peer support work.
I accessed a day hospital admissions program. I had people talk to me that had been through the same program and been where I had been, and it helped me immensely.
I met a lady who was a peer support worker. She supported me through my journey, and I remember thinking at the time that that was something that I would really like to do.
I did get the support I needed, and it was really important for me to give back and to also help folks who are in the system, inpatient, or out in the community to know that they're not alone.
So the Patient Client and Family Council is a nonprofit organization that provides support, education, and advocacy to people that are struggling with their mental health, to family members that are supporting someone with mental health and/or addictions, and to service providers to help move the system forward with an understanding of what it's like to be using those services for yourself or a loved one. Everybody that's involved in the Patient Client and Family Council, from the board members to the staff to our volunteers, have all walked that path and dealt with the challenges of mental illness. And so we're in an excellent position to be able to provide those services from a lived experience perspective. Our mission speaks to support, education, and advocacy. So we work with a lot of organizations that are putting in new processes on what it's like from the other side and how the system can be better. We often get asked, how can people get involved in the Patient Client and Family Council? So there are a number of ways. First of all, we have numerous volunteer opportunities. We're a very supportive environment because we are all peers. We take volunteers on our board of directors, and we're often asked, well, I don't have any experience on a board. You have experience because you've been through the system or had to access the system, and that's what we want from you. We also offer employment opportunities. Sometimes when people have been accessing the services for a while and been out of work for a while, it's a big, huge step to try and get a job. With us, it's a step-by-step process from volunteering to supported employment to having a job of working directly for the council.
We provide services and peer support on every single program at Waypoint. A lot of my own lived experience has been on inpatient units, and I can tell you without peer support, it's definitely very isolating. It's great to have a peer support worker come to the program. It's a familiar face, someone that they can speak to and get support from in confidence, and it's all on their terms. So if someone wants to chat with me as a peer support worker one day, and the next day they don't really feel like it, it's completely up to them, and it gives that autonomy back as well.
We are meeting people eye to eye, and we're there to open up the door for them to discuss any issues they may have as far in depth as they wish to go, and we have our lived experience to share with them as well.
It's so important to have peers working at Waypoint because it gives patients a glimpse of what life is like beyond mental illness and in recovery and how they can get there. Having someone who's been in the same situation you've been, it really inspires hope.
I have a daughter who has mental health issues. Attending the Family Connect meetings has been wonderful for me. I have been able to share my story as someone who supports a family member with other people who've attended those meetings, and it's amazing and wonderful to realize that I'm not the only one who's going through it.
We have a community location at the Hero Center on King Street. We partner with other agencies, so we will go into other agencies for specific meetings, specific sessions or work groups. We'd like to be providing services more broadly, linked in with the family health teams to support people there. We'd also like to provide services at the local emergency departments and hospitals, because when you come into the hospital in crisis or with the family member, that's the best place to have support from people that have been there before you, have walked a similar path. We're looking forward to a change in location in our community services. We are moving down to the shared hub space with Waypoint Centre for Mental Health and for Chigamik Community Health. This is an exciting opportunity to narrow the gap again between clinical service providers and the people that access and have the experience of using the systems. We're looking forward to a great collaborative partnership and a better service for anyone that's looking for help.
Our place is a member-driven social club open to anyone in the community, ages 16 and up, who identify with having a mental health concern or an addiction. It's got a variety of different activities. When you come in, you'll usually be greeted by myself or one of the other peer supporters. Really, we will just check in with you to see where you're at and what you need. You can use the club however you need to, whether it's just sitting down quietly with a book or meeting one-on-one with a peer support worker or playing pool with one of your friends. Really, it's just a place where people can come, be safe, and converse with people who are living in similar experience. We also provide formal peer support at the YMCA Youth Night on Friday nights, and we do support youth inpatient and outpatient wherever we can.
RAM to me is everything under one roof for addiction and mental health care. They have locations in Midland, Orillia and in Barrie. In my role as a peer support worker there, I will sit right into the waiting room with the clients and strike up a conversation and let them know that I have lived experience with addictions and mental health. And that seems to change their view on how they're feeling and makes them a little more comfortable to enter into the process that they're about to enter into.
I think that peer support works because having someone who knows what you're going through without having to explain it is extremely beneficial.
There's a special understanding between two people who are struggling with the same problems. To be able to say to somebody else, I know how you feel, and have that person look at you and know that they understand. You know, in my journey, without peer support, I don't know that I would have gotten through the process as well as I did. So a peer support worker is a valued member of any addiction and mental health team.
For someone who's struggling and not sure what to do, the first thing I would say to them is you're not alone. There are many people that share the same experience as you. Reach out however you can. You can reach out through our Facebook page, Instagram, website, email. You can give us a call. Any way that you feel comfortable, we are more than willing to meet you where you are.